Hey there, Food Junkies listeners. Before we dive in, we've got something really special for you, and it's time sensitive. How does a free live stream ticket to the International Food Addiction Comorbidities Conference sound? That's a $140 value, and we're giving away 20 of them. Here's the deal. For every $25 US donation you make, your name goes into the draw. $50, that's 2 entries. $100, that's 4 chances to win. The conference happens September 4th and 5th, 2025, live from London. But with this live stream ticket, you'll get front row access to 17 expert speakers, 2 groundbreaking panel discussions, and the latest research and recovery insights from global leaders in the field. But hurry, the draw is happening September 1st. This giveaway is hosted by Food Addiction Solutions and Sweet Sobriety. And here's the best part. Your donation doesn't just get you in the draw, it helps us fund the science, the community, and the advocacy that's changing lives. So check the show notes for the link. Don't forget to include your name and email so we can reach out to you if you win. Let's build a healthier future together. Now, on to the show.
Welcome to the Food Junkies Podcast. Here, we aim to bring you the experience, strength, and hope of professionals working on the front lines in the field of food addiction. Our mission is to educate you, the listener, and increase overall awareness about food addiction as a recognized disorder. Here, we discuss all things recovery, exploring the many pathways people take towards abstinence in order to achieve a health-forward lifestyle. We hope to inspire you to thrive rather than just survive. So stay positive, make a change for yourself, and share your journey with others, and hopefully the message will spread.
Lipedema, what is it and how does it relate to food addiction? Welcome to the Food Junkies Podcast. My name is Dr. Vera Tarman, and I am your host today, speaking with Bonnie Newlin, who is a registered dietitian nutritionist and certified LEAP lifestyle, exercise, and performance therapist, specializing in nutrition management of lipedema and chronic inflammation. Bonnie holds a Master's of Public Administration at Oklahoma and Bachelor of Economics from the University of Maryland. She completed her dietetics training at the University of Northern Colorado and a Master's in Human Nutrition at the University of Houston. She is certified as a Registered Dietitian Nutritionist by the Academy of Nutrition and Dietetics. Bonnie is also the founder and CEO of Crave Nourishment, where she works with women through evidence-based anti-inflammatory nutrition. She also sits on the Lipedema education group and contributes to the development of medical standards of care for lipedema. Of note to us, Bonnie has had her own journey, which includes a 170-pound weight loss and a diagnosis of lipedema after struggling for years with weight and food addiction. So what can she tell us about how to deal with this condition in our population? Welcome, Bonnie.
Thank you so much for all of that. I appreciate that. That was a nice introduction.
So what is your experience with lipedema, and how does your food addiction and weight cycling contribute to your diagnosis from being delayed?
Yeah, I think everybody that has lipedema, we all have a similar story, and yet they're all different because lipedema comes in at different times of hormonal change in a woman's life. There are men that have lipedema, and I'll talk about that a little bit later, but it primarily impacts women. And in looking back, always knew that something was wrong with my body. I just didn't have a name for it. And I remember from an earlier age, really early age, dieting with my mom, who also struggled with her weight. And many of the women on my mom's side of the family struggled with their body weight. So I was on diets early on. And sadly, we would diet and have a successful week, and then we would go out and get a Hostess snowball. I'm not sure if you're aware of what those are, but it's basically an ultra-processed cupcake covered with a marshmallow topping. And that was my reward for adhering to whatever the said diet was at that particular time. I did many diets throughout my life. I think that when you struggle with body weight, especially from an early age like I did, there's a shame that comes in with all the attempts at trying to get your quote unquote willpower and your body under control. And each time you fail at that, it just starts to erode at your self-esteem. And so I went through those cycles, and then being heavy as a teenager and into my early 20s was difficult. I think for me, ultimately, the lipedema got really bad as I lost 150 pounds, which it may sound interesting, but I lost 150 pounds and I started to notice a difference in my tissue, meaning that the appearance of my legs after such a big weight loss, and I had maintained the weight loss for a while, started to get worse. And I was going through menopause at the time, and that's really when my lipedema kicked off. So for me, it really was more pronounced later in life, although the underlying issues of lipedema was always there. I always had heaviness in my limbs, my legs were swollen. I had massive daily weight fluctuations, early bruising, hypermobility, and issues with hamstring tears and labral tears and things like that throughout my life. But I didn't go to doctors per se for any of those issues because I just thought they were all related to being overweight. Yeah. And when I did go to the doctor for things like my annual checkup, it was always lose weight, exercise more. And I was failing at that. It wasn't until I lost a substantial amount of body weight, really, that I got the diagnosis. I went in and they were able to look at my legs in a smaller body and say, oh, something is off.
Okay, so tell us, what is lipedema?
Yeah. So lipedema is a complex disorder, but it causes issues with the microvasculature. So we have fragility of our vessels. We have leaky vessels. It also is a connective tissue disorder, an adipose tissue disorder, and it's progressive and chronic, and it causes a symmetrical buildup of fat primarily in the limbs, but it does impact the trunk, and it can happen in the hands and feet, but it typically does spare the hands and feet. So it can cause a really pronounced weight gain in the lower half of the body. And as the tissue and disease state progresses, it can move up to the upper part of the body.
This is a diagnosis that would have surpassed me. And I would have thought this is a distribution of not visceral obesity, but peripheral obesity. What is the difference between lipedema and versions of obesity?
Yeah, with lipedema, there's actually a difference in the tissue. There is immune suppressing macrophages in the tissue. And I wrote down what they were because that's a little bit outside of my wheelhouse, but CD206 and CD163. There have been studies. There was one by Stephen Wolf in 2022 in Frontiers that showed that the lipedema tissue has infiltration of these macrophages that create a constant state of low-grade inflammation. And over time, that creates the tissue expansion that we see in lipedema. And it's this progressive state. And then we see that the tissue, as it expands, causes fibrosis. And there's a back of the lymphatic fluids, which then can cause issues with even more issues to the connective tissue and that fluid backing up, and waste products can't get out and be properly eliminated. So that increases the toxic load in the body even more.
Can you give a visual description how it's different than obesity?
If you look at a woman with lipedema, there are different types. So sometimes it can be different on presentation from obesity, but sometimes not necessarily. A lot of women with lipedema will have columnar shaped legs, which create cuffing both at the wrist and at the ankles. And you would definitely maybe recognize that type of lipedema. It looks like there is cellulite on the body, but there's actual fibrotic nodules when you palpate the skin. And they can feel like bean bags or rice under the skin, all the way up to walnuts, different filling of fibrotic tissue. But not all women with lipedema have that columnar shape. I don't have that. I have a smaller ankle, but I still have lipedema in my limbs. But one of the kind of hallmark features of lipedema for many women is that the weight gain is from the belly button downward initially. So even women that are in stage 1, just the beginning stages of lipedema in an irregular sized body, will have more characteristic weight gain in the hips and thighs to start, and then it starts to progress from there, typically speaking.
They would know that something was amiss when they feel the texture of their body. This is not cellulite. This is actually a marbled feeling underneath the skin.
It happens over time. I think the earliest symptoms might be a heaviness, but you don't know what you don't know. I had heavy legs my whole life, and I just thought that's the way that all women felt. I had no idea that the heaviness wasn't normal for everyone, but my legs would swell by the end of the day. My feet would grow in size, and I would feel like I would need to go a size up in shoes from time to time from severe swelling. Also, it can be the tissue over time becomes painful to the touch because as the tissue expands, it forces the vasculature closer to the surface of the skin, so women bruise more easily, things of that nature. So those are the early symptoms, but not all women bruise and not all women will experience pain. Some just have the heaviness. A lot of women, for example, will report when they get their blood pressure drawn, the cuff is extremely painful for them. So it's little things like that to pay attention to.
The cuff on their arm as well?
Yes, the blood pressure cuff.
Okay, interesting.
For holding a child or a pet or something like that.
How would a woman know that she might have it? You mentioned there's the heavy legs. Does it actually hurt? Besides visuals, what other symptoms might a person feel?
It does hurt. A lot of times it goes hand in hand with venous insufficiency. I was talking about the issues with the microvascular earlier. A lot of women do have issues with venous insufficiency. So if you go into a vascular doctor, that's actually a way that a lot of women tend to get diagnosed. It also runs in families. So we know that about 80% of the women with lipedema seem to have a family history of lipedema. It's believed to be autosomal dominant, but it doesn't seem to have complete penetrance. So not everybody that has a mother that has lipedema is necessarily going to get lipedema. So whether that's genetic or epigenetics completely at play is not really clear in the literature at this point.
There's the feeling of heaviness that might lead to painfulness, and anything else that a person might?
Heaviness, swelling. For me, one of the biggest things in looking back, honestly, was just erratic fluid shifts. So I could step on the scale and gain 8 to 10 pounds literally overnight, especially if I ate foods that were higher in sodium, because lipedema tissue retains more sodium. We know there's more sodium on biopsy in lipedema tissue. And so there's this fluid imbalance, especially as the stages start to progress, you start to see more fluid accumulation. So
might that translate to higher blood pressure?
That's what's really interesting. Some women do have higher blood pressure, but a lot of lipedema women do not. Labs tend to be within normal limits, even though there's excess body weight.
Okay, good. So how common is this?
It happens in about 11% of women, but that being said, the 11% are the women that have been diagnosed. There is no centralized tracking of lipedema right now. So although it's rarely diagnosed still at this point, it's not necessarily a rare disease. And once you know what lipedema is and what to watch for, you see it all over. I was in an airport yesterday and I see women with lipedema. And it's just heartbreaking because I just wonder if we knew sooner what it was, if women could stop the progression.
You mentioned venous insufficiency, which translates to varicose veins, and does it also translate to lymphedema? What's the difference between lipedema and lymphedema?
Yeah, so we know that both have swelling. I'm going to progress to my notes here so I can make sure I get everything. The difference is that the buildup of fluid in lipedema is symmetrical. With lymphedema, you may just have it in one limb, but with lipedema, the swelling is pretty even on both of the limbs or throughout the body. As lipedema progresses and we see that pressure put on the system, the body, the fluid accumulation does cause lymphedema in many, and that's called lipolipedema. And that's commonly seen in stages 3 and 4, although I have lymphedema and I was diagnosed at stage 2. So it really just depends on the person. But Lipedema is not a primary lymphatic disorder like lymphedema is. It's a connective tissue disorder and an adipose tissue disorder.
It's not that one becomes the other on a continuum. They're two separate conditions, but they can overlap.
They can, and they often do in later stage lipedema.
And for people who don't know what lymphedema is, the visual for that is the person who's got really swollen calves that are wrapped up in all sorts of bandages, and it's seeping, and it just seems like a miserable condition to have.
It's so hard to manage too. It's really hard to manage, and that can lead to cellulitis and all kinds of other issues, like you said, the weeping tissue.
Yeah.
And unfortunately, in lipedema, that fibrosis and that interstitial pressure puts so much on the vessels that it leads to that fluid accumulation, and for many does ultimately result in the lymphedema as well. And then you're managing two things, which is really hard.
Would it be fair to say that lipedema is an adipose tissue disorder and lymphedema is a lymphatic disorder?
I think that's correct. Yeah.
Okay.
There is a bit of a difference between the way that the disease is viewed in the US versus Germany, though, and I should say that. The German thought is that there is not swelling or edema in lipedema. The US thought is that yes, there is. And many women with lipedema find it to be very helpful to have manual lymphatic drainage, which helps to move the lymph fluid, and also use a pneumatic pump to help reduce the fluid accumulation. And so those are part of a daily conservative therapy that is often used for women with lipedema. Whether they have lymphedema or not, some report that they really feel relief from using both of those modalities.
That's interesting because I'm aware of that modality for lymphedema, but so yours can be used for lipedema, or it is typically in Germany.
Yes, and it is here too. A lot of women in the US will seek out trying to get a pneumatic pump.
Is it mainly a genetic disorder or is it food mediated?
Yeah, I don't know that we fully know that, but we know that 80% of the women that have lipedema seem to have a family history. But that doesn't mean that if mom or grandma or aunt has lipedema, that one will necessarily have it or that it will progress to the same stage. So there have been women who have family members who have stage 3 and 4 lipedema, and maybe their progression is at stage 1. There's definitely a component of the food mediation part of it as well, especially the ultra processed foods, because it's an inflammatory condition.
Yeah, why don't you elaborate on that?
Yeah. So the role of inflammation in lipedema, like I was saying earlier, is that we know that there's an increase in macrophage or pro-inflammatory mediators in the lipedema tissue itself. And when we eat a diet that is ultra processed and we increase the environment where there's more inflammation by eating these foods that are more processed, it can progress the lipedema tissue and create more swelling, more lymph fluid backup, and all of the things that possibly progress the tissue expansion. Oh, and I was going to say there's the whole sodium aspect of it as well, is that the ultra processed foods are so high in sodium, which in a normal bodied person can cause fluid retention. But when you have lipedema, and we know that our tissue has more sodium to begin with, and now we're adding even more sodium, the swelling can become even more pronounced. And women do report more pain when they eat ultra-processed diets. It's very hard to get away from those foods when that's become a staple in so many diets. And unless you know what you're buying sometimes.
It sounds like there's a genetic piece, and then there's the foods because it's an inflammatory piece. How is it related to obesity itself? Can a person lose weight still have lipedema?
Absolutely, yeah. The tissue at this point in 2025, we don't think you can diet away lipedema. There have been several studies where they have shown that women have been able to lose weight, but the lipedema tissue is biologically different. We know that it has all of the things that I was talking about earlier. It has more macrophage infiltration. And even after the weight loss, those inflammatory mediators still seem to be in the tissue. There's still pain. So there's women that have stage 1 lipedema that aren't overweight or don't have generalized obesity that still report the pain and the swelling and things of that nature. And so we're not sure exactly how, or the researchers aren't sure exactly how the tissue responds for long periods to better eating, I guess is a better way to say that. But we know for a fact that when you eat a better diet, people report less pain and swelling. And it seems like the staging can be controlled. Although it's a progressive disorder, if you know that you have lipedema at stage 1 and you start an anti-inflammatory diet and conservative therapies like movement and keeping the lymphatics going, wearing compression, the conservative therapies that people choose may be different based on their bodies and their particular situation, but not all people progress to a stage 4, for example. Some women can keep in the stage that they're in. The other part of that with the ultra-processed foods, and this was something that I'm passionate about and spoke about at FDRS this year, which is the Fat Disorder Research Society conference, is as women eat more processed foods, we disrupt the gut microbiome balance, and we start to see more lipopolysaccharide bacteria in the gut. And as that LPS increases, it seems like there are more issues with pain and swelling. And I definitely see that in my practice. As we start to see leaky gut happening and the immunity, because the gut is out of balance happening, there's more hormonal dysregulation, there's more pain and swelling, there seems to be more progression. There's definitely more issues with the leaky gut and things of that nature and all the things that go along with that in later disease states related to lipedema, or so it seems.
We have so many different versions of inflammation in the body, everything from diabetes to Alzheimer's. And this is just yet another inflammatory response in the body, but in the adipose tissue.
It really is. And one thing that's really interesting with lipedema is that lipedema tissue is actually protective in some ways against things like diabetes. And I know even insulin resistance is something that's peculiar, because you see that oftentimes insulin resistance is increased in the overweight population, but in lipedema, only about 1/3 of women with lipedema have insulin resistance. And we tend to have a higher level of adiponectin hormone. So it's this interesting dichotomy, to your point, that we have all of the things that should be progressing metabolic disorders in one way, but for some of us, they tend to be protective, but causing different inflammatory issues.
Did you want to say more about hormones? What hormonal changes? You mentioned it was in your menopause that you started to notice. So what's going on there?
Yeah, we see that lipedema progresses during times of hormonal shifts. So we know that estrogen is definitely involved because it mainly does impact women. Although there are men that have lipedema, and there are men that tend to have low testosterone, or maybe they have cirrhosis or something that impairs the estrogen metabolism. Women that go through menopause can experience lipedema progression. So when the estrogen is getting lower, something about that imbalance in the hormones causes progression and tissue changes. For me, that was really the difference. Is I started noticing that my thighs were just really becoming very cellulite type of structure, but I could feel and palpate that there were nodules in there. And the bruising got really bad during menopause as well. So a lot of women will report that during times of hormonal shift, whether it's they go on birth control or at puberty or have a child, that they start to notice that blow drying their hair and doing basic activities like that, their arms are becoming really heavy. And for whatever reason, it's the hormonal shift that sort of turns on the progression of lipedema. And I'm not sure that the mechanism there is completely understood at this point, but just that it is definitely involved. So that's one of the most important things, is trying to not only manage your nutrition in a way that is hormone supporting, but also if you have the ability to really stay on top of watching those labs to make sure that your hormones are stable when you're going through times of transition with hormones.
Could it even be within the month, a woman's cyclical month, that maybe during PMS, there's slight variations in sensations?
That's a good question. A lot of women, but not all, do report that they have more swelling in the week leading up to their cycle. I think we're hungrier, typically speaking, in that week. So I don't know if that is necessarily food related or if that's just a function of the way the hormones are changing. But I think it definitely does have an impact. I'm just not quite sure what that is.
What about polycystic ovary? Is there a high incidence of lipidemia in that population?
There is. I don't know what the statistic is actually. I haven't looked at that recently, but there are quite a few women with polycystic ovarian syndrome, endometriosis, and things like that that also have lipedema. And that's one of the pushes is to really get into GYN clinics and see when somebody has polycystic ovarian syndrome, could lipedema be there as well? So get earlier diagnosis.
What are some myths around lipedema?
That's a good question. There are a lot. I think that one of the main myths is that lipedema only happens in overweight. So a lot of times people assume that when you're overweight that you're going to get lipedema or that you got lipedema because you were overweight. And lipedema happens in normal size bodies too. We know that I have several clients that are, by all standards, normal size bodies, and they are struggling with the same pain and same feelings that women that are stage 4 have. And that's the other interesting thing, is that stage 1 and 4 can have different levels of pain. There are some women at a stage 4 that have mobility issues, but maybe not necessarily the pain that somebody at a stage 1 is having. So there's shifts there. Some of the other myths are that you can diet lipedema away. Certainly, reducing body weight does help. It alleviates pain on the joints and pressure and all of that. But there's still that component where the lipedema tissue is biologically different. There have been several studies done. There was one just done by Dr. Wright. It was published in Diabetes in 2025, I think March. And they showed that even when ladies with lipedema lose weight, the tissue is still showing a higher incidence of interleukin-6 and tumor necrosis factor alpha. Those pro-inflammatory mediators are still present even after weight loss.
You mentioned earlier that about maybe 11% of women, mostly women, have this condition. Why is it that I have not heard of this as a physician? Is it something that is fairly new in terms of understanding, even in the obesity bariatric world? I don't hear people talking about this.
Yeah, that's such a great question. And I agree. When I went through my training as a dietitian, I had never heard of lipedema either. And actually, quite honestly, until I was diagnosed. I think that one, there's not an ICD code in the US that's active for lipedema, unfortunately. So I think that's part of it. And I think that it presents for many like obesity. And so I think for so long, women have been misdiagnosed and not heard when they go in. And I think, and I can say this having been there myself, that when you're overweight, you're reluctant to bring up your symptoms because you think that it's just going to be related back to your weight. And so I think it's just a lack of knowledge. And unfortunately, I don't really know the full answer to that, but I think that is changing though. The Lipedema Foundation here in the US is very active about attending conferences here in the US and educating providers and other allied sciences about lipedema.
Hey, Food Junkies listeners. We're just going to take a quick break here to share with you something our team thinks could help benefit your recovery with food, body, or self. Thank you again for listening.
Hey there, Food Junkies listeners. Have you grabbed your ticket yet for the International Food Addiction and Comorbidities Conference 2025? It's happening September 4th and 5th in London, England at the iconic Royal College of General Practitioners. This is the global gathering for professionals passionate about tackling food addiction and its related conditions like type 2 diabetes, mental health disorders, cardiovascular disease, and more. Come learn from world-renowned experts like Dr. Georgia E., Dr. Nicola Bina, Dr. Nasha Winters, Dr. Erica Lafata, Dr. David Wiss, Dr. Kim Dennis, Professor Adrian Sotomoda, Karen Thompson, Dr. Ignacio Caranta, and Dr. Trocalasian, plus insights from UNICEF's Mauro Brero on transforming food environments for kids. Earn up to 13 continuing professional development hours, enjoy a nourishing midday meal all included in your ticket, and connect with clinicians, researchers, and changemakers from around the world. Early bird tickets, 1-day, 2-day, and live stream tickets are on sale now. but only for a limited time. Head to the show notes and secure your spot at IFAC 2025. Let's move this conversation and this movement forward.
Now back to the show. If you have enjoyed this episode, please let us know. We love to hear from you. Kindly leave us a review on whatever platform you listen to our podcast on. We love getting feedback from our listeners.
Would it be fair to summarize that although it might be 11% in the general population of women, that in the people who suffer from metabolic disorders, inflammatory disorders, food addiction could probably be much higher than 11%?
Oh, we think it's much higher. And because there's no centralized tracking, it's 11% that have been diagnosed.
Yes.
Not necessarily 11% that have it. It's just 11% of women that we know that are actually diagnosed. And I think the sad part of that is that if you don't have a diagnosis, then you go on just assuming that there is something wrong with your willpower or something that you're doing, and you internalize those feelings, and it's harder and harder to help your body heal because you don't know what to do to help it heal. So yes, I think that's a very true statement. I don't know what that is, but I think that's really low. I feel like I see lipedema in a lot of women, and it's unfortunate. And I was going to say, I think the other part to your point earlier is that a lot of women that have self-diagnosed, which is very common, have a hard time getting a medical diagnosis because physicians just don't know about the disorder. Yeah. And a great resource is the Lipedema Foundation does have a clinician's guide that you can take in to your doctor, but there's not one single test that can tell whether or not you have lipedema. It's a clinical diagnosis and a collection of genetic variants that sort of make up this inflammatory mix. It's not just one thing that allows for easy diagnosis at this point.
I know myself that I don't ask questions that I should be asking because I don't have a solution. And I would imagine that if somebody does know about it, they don't know what the treatment is. Let's talk about treatment. You mentioned this yourselves, the idea about shame around obesity. And now we've got this additional shame that people walk in with, the state of their legs or symptoms that they don't know what to make of. So how do you deal with that?
Yeah, I think dealing with the mindset piece and letting them know that it's not a function of their willpower. But unfortunately, I think it's a whole systematic issue. One, maybe they've been misdiagnosed or not diagnosed with lipedema. So that's one issue. The other issue is all the ultra processed foods that are out there that are just contributing to the condition. And then just societal marketing of foods. I feel like so many people don't know how to select healthy foods, and a lot of the foods that are marketed to consumers are pretended to be healthy, and they're just ultra-processed foods that actually make the condition worse. So I think it's a culmination of things, not just one thing.
Okay. How do you help people break free from the restriction binge cycle that often accompanies this condition?
I think the first thing that I do is really start to help establish a lifestyle. When you get a diagnosis like lipedema, there are so many different things that you see, hear, and read, and you think you need to do all of them today. And that causes a whole new level of overwhelm. And so just understanding that you need to do a few of the things that work for your body. I like to hone in on where someone is and meet them where they're at and what is going to be a sustainable change for them in that moment, and then build on those habit patterns. And depending on where a person is with what their diet history is or what they're currently eating, because I do have women come to me who have already made the dietary shift away from ultra-processed foods. I have other women who are really leaning on those convenience foods. And so their protocols will look a little bit different. But I think the first part is working on the mindset and really letting them understand the no and the how in terms of how these foods impact our biology, and letting them know that you can really change the course of the way that you feel by what we eat and possibly the disease progression, and leveling things out hormonally by the things that we choose. That was a long-winded answer, but
yeah. Do you find that there's a lot of people that you work with that you would suspect have food addiction?
I would say that they would, yes. And I know sugar addiction always comes up. And what is interesting in the lipedema community, and I've worked with thousands of patients over the years, and I will say that the lipedema population is probably one of the most educated patient populations out there because they have been so starved for figuring out what's going wrong with their bodies, our bodies, that we have literally researched to the hilt.
Yeah.
That's what drove me to go back and become a registered dietitian myself. I include myself in that explanation, but I think that what I see is that people don't understand that some of the carbohydrates that we eat are sugar, essentially. The processed carbs that are devoid of water and fiber, they just turn to glucose, and they don't realize that those foods turn on the dopamine, and then you want more and more, and there goes that cycle. So I think in that regard, yes, I don't know that clients come to me really understanding that they have food addiction, but after working together, I think many understand that they lean on those foods, and there's a reason why we then want more and more of those. And sometimes, a lot of the times, abstinence is the answer, because if you have those foods in the house, and in the past we've been told to eat those foods in moderation, what does that look like? That's a really hard thing for somebody that struggles with foods like that.
You talk about an anti-inflammatory diet. You're not using food addiction diet, although it is implicit. Aside from avoiding ultra-processed foods, what would your diet look like?
It's different for everybody. So I don't subscribe to a one-size-fits-all approach. I use integrative testing in my practice, and I'm just getting into DNA testing to try and really hone in on what works for somebody. So it will depend on if somebody has insulin resistance or not, what I recommend. But at the core, anti-inflammatory eating is whole foods, paying attention to sugars, paying attention to the fiber and water content in foods, and staying away from foods, like you said, that are more processed, sodium laden. For some women with lipedema, that means not having gluten. We know from some recent research that about a third of the women with lipedema, or maybe 40% of the women with lipedema, tend to have non-celiac gluten sensitivity. So that's one issue. And a lot of women have issues with dairy. Not necessarily all forms of dairy, though. So fermented and aged dairy doesn't seem to have the same impact as butter and milk and things of that nature that aren't aged or fermented. So it's interesting.
That is really interesting, because we say the very same thing in the food addiction community, that there are a number of people who can't eat dairy and who can't eat grains.
Yeah, I definitely noticed that in myself. If I eat grains, I was just away for the weekend, and when I'm out of my normal dietary patterns, there's definitely an increase in my swelling. I think for women that struggle with insulin resistance, we do really watch the grains and some starchy vegetables at the start, and then figure out where that balance is for them in order to reach a healthy body weight for them that works for them and that makes them feel their best. So it's a little bit different for each person that I work with where that is. But essentially, we go through a 15-week lipedema-specific program and talk about the research. It took me 8 months to build this program, reading research to see what does the science say right now about lipedema and what are the things that we can control. And it is a little bit different tweaking for each person, but at the core, it sounds like a lot of it might be similar to what you recommend for.
Yeah, it sounds like an actual overlay. That's really interesting. Including the length of time of a program, up to 15 weeks. That would make a lot of sense, that you're treating without even realizing it, the food addiction piece. What about fiber? What's your take on fiber?
I think fiber is paramount. I think fiber has to be there. There's a lot of research with regard to the ketogenic diet in lipedema. And really one of the hallmarks of the ketogenic diet is that it removes the ultra-processed foods, sugars and grains and things of that nature. So I think no matter what dietary style somebody wants to eat, that's the first thing that we work on. Fiber is so vital because it lowers the impactful carbs, as I call them. So you don't have the same blood sugar spike. It makes your gut healthier. It helps diversify the microbiome, different types of fiber that we eat. It lowers that lipopolysaccharide that I was talking about earlier, the bacteria that we know causes leaky gut. And it just seems to make everything better in terms of our satiety and our fullness. Nobody's going to be able to eat a diet or eat a lifestyle, if you will, for the rest of their life if they're hungry. And because fiber makes us feel fuller longer, it makes life more pleasant. And I think that's an essential element to the mindset piece of being able to eat in a specific way. When you think about the way that lipedema just thrives on inflammation, one of the biggest benefits of fiber is that it's pulling that water into our bowel and eliminating waste, and we're getting rid of some of those toxins. It's just that whole piece with fiber is so important for lipedema, the bowel modulation, giving the fullness, and then really feeding the gut.
Just to play the devil's advocate, what about a carnivore diet where the satiety is dealt with by eating a lot of protein and fat? There's no fiber, and the carnivore community actually don't need fiber. You're talking about fiber as nullifying the consequences of the carbs that a person is eating. But if they're not eating carbs at all, do we need fiber?
Yeah, so there's no long-term research with regard to carnivore, and there's not much research, if any, that I'm aware of with regard to lipedema. So the answer is I just don't know. There's a ton of research out there, though, that shows that fiber is great for the gut. So if we want to lower inflammation and we eat fiber, we know that can help with making the gut microbiome more diverse and more populated, which helps with our immunity. I just don't know. There are women that report that they have less symptoms initially on a carnivore diet, but it doesn't seem sustainable. That's really the problem, is that if you're in a little bubble and you eat like that, it works for a short time, but I don't find it to have a good sustainability rate. And it can become boring after a while for many, eating just meats and butters and things like that. So I guess it really would depend on the person. I worry about the health of the gut only because there's no long-term research with carnivore that I'm aware of that shows that. So verdict's still out. I do think it can be possibly a short-term intervention. And I have seen people do that if they, in other issues, not necessarily lipedema, but to maybe get swelling down. And I think, again, it depends on the person. Does somebody have a sensitivity to something or a certain type of grain? Then perhaps I see it to be useful.
Could lipedema be an allergic response?
We know that a lot of women with lipedema, a very high comorbidity is mast cell activation syndrome. So again, here we go. Mast cell isn't just created in the gut, but you certainly have histamine producing bacteria in the gut. So if you don't have good balance in the microbiome and you're populating more of the bacteria that sensitize mast cells, now you've upregulated swelling and all the inflammatory cytokines come rushing in. So it's this nature of not sure what came first. I know Dr. Herbst, who is an endocrinologist and very respected in the lipedema space here in the States, has talked a lot about the comorbidity of mast cell. And is it mast cell dysregulation that can uptick lipedema, or is it lipedema that can uptick mast cell? And we're not sure. But not all women with mast cell require a low histamine diet. Some do if they're in the active phase. And I have mast cell myself. Actually, I knew I had that long before lipedema. It's completely controlled now, but I eat a very anti-inflammatory diet. But not all women are triggered mast cell wise with diet. Some have environmental factors like sprays and perfumes and things that sense and vibrations. So there are different triggers. So that's a tricky question, but there's definitely some sort of overlap there as well.
Maybe we would see that in the people who are dairy intolerant, for example. They'll get congestion in the nose.
That's the number one symptom, yeah. And I was thinking that there are bacteria that, like, I see sometimes that women that take probiotics that are really high in lactobacillus, especially a lot of the store-bought brands that have many strains, that produces more histamine.
Wow.
And so then they're upregulating the histamine production, and maybe they're already sensitive. So yeah, it's hard to tell. It's really tricky. And that's, I think, one of the nuances of lipedema is that we all have this underlying similarity, but there are some differences. And that's why just a straight across diet doesn't necessarily work for everybody. It really has to be a lifestyle honed into their needs, I think. And it is, to your point, anti-inflammatory. At the basis of it, it has to be.
Okay, getting back to the idea of early diagnosis, you mentioned that you're at the airport and people and you wish they had been told earlier. What could have been done earlier? Be aware of the diet that's making it worse. What else can you do? This is a chronic progressive condition.
It is, yeah. It is a chronic progressive condition if left untouched, but it doesn't have to progress. I think some of the top things that I would recommend are just gentle movement. When we move, we pump our lymphatics. And one of the things that we know with lipedema is that when you have congested tissue, because you have that backup of the lymphatic fluid, you recruit more fibrosis and more nodules because the lymphatic fluid is protein rich. And so when we move and we pump our muscles, we're moving that lymphatic fluid. So that's one of the things. So simple as just drinking water along with that, because staying well hydrated thins out the lymphatic fluid. So that is extremely beneficial. And we can all do that. Drinking more water and letting go of some of the other beverages that people drink throughout the day is so important. Really staying away from the ultra processed foods and prioritizing protein and fiber can be great for lipedema because it really helps to stabilize blood sugar and avoid any type of blood sugar spikes, which lend themselves to low-grade inflammation.
What about coffee and tea?
Oh, that's a good question. I know. We all process caffeine differently, right? So for some people, caffeine can spike blood sugar, but not for others. I like coffee. It has tannins in it as well, which can help with bowel elimination. But tea, I guess, as long as it's not sweetened, can be fine. A lot of women drink it and seem to be fine. Green tea can be great. So I think that's fine. I think sometimes it's what we add to coffee and tea that become the issue. Black coffee and tea, not as much, but it is a stimulant. So if it's causing sleep disturbance, if you're not getting good sleep, then you're reducing your insulin sensitivity. And that's another issue for about 1/3 of women with lipedema.
So that if they don't get enough sleep, they're going to feel more sore and more swollen.
Exactly.
Which again is another way for somebody potentially to self-diagnose themselves if they find that they eat particular foods or don't sleep well enough or are upset and they feel more achy and sore. This is a potential sign of maybe stage 1.
Yeah, and I think that's as it progresses, women have problems sleeping because the tissue is tender. So turning is a constant turning to avoid being on one side too long is an issue as well. And quality sleep is so important and stress reduction. And I feel like everybody's going a mile a minute and doing the things that we need to get back to basics to lower the stress and get better sleep and work with your body's natural rhythm is so important. Oftentimes, too, I think if we're up working late or trying to burn the midnight oil doing something else, we will find food to give us energy to stay awake. And eating late into the night, we know is not good and really impacts swelling and inflammation and weight gain. And so it just becomes this cycle. We eat to stay awake. That makes the tissue worse. That makes the insulin sensitivity worse. It's like this cycle when we can't control those things.
Okay, so using as a N of 1, you lost over 150 pounds a long time ago. And that's when you discovered you had lipedema, but you're able to manage it. So how do you manage it now? Because you say it never goes away. You're just managing it.
That's such a great question. I was in Colorado over the weekend for my son's birthday and it was 100 degrees and we were hiking and I was like, I could never have done this when I was diagnosed because I just don't have the same level of swelling and pain anymore that I used to have. Part of that is due to diet, but I lost 150 pounds and my symptoms were more pronounced in terms of the tissue and the way that it looked and presented. But the pain, the underlying heaviness was always there. I didn't have really, I guess, pain. I had more the heaviness. I started noticing more bruising and things like that. What I'll say too is that I did have lipedema reduction surgery. So it's not quite a fair question because that did help. I had that after losing 170 pounds. So I had lost 150 pounds. And then when I found out I had lipedema, I really put myself on a more anti-inflammatory style diet. I started watching my sodium. I researched all the things and started doing conservative therapies, drinking more water and getting more rest. And I lost an additional 20 pounds. And then I wanted to see if that would resolve my symptoms. And when it didn't, I opted to go in and have the lipedema reduction surgery. And so a little bit of an unfair statement. I just want to be open that I did have that. And that really did make a difference for me because I don't have the swelling and the pain anymore. And it's not a cure. Even when you have the reduction surgery, it just resets the stage.
Okay, so then we're talking about diet and now alternatives.
It's a lymph-sparing liposuction essentially that is done hopefully by lipedema-informed surgeons. And they go in and they remove the tissue. But when they're doing that, they're also removing normal fat cells, right? So the risk can sometimes be that if you treat certain parts of your body, to your point, then if there is continued weight gain, you might have pronounced weight gain seemingly in areas that weren't treated because the regular fat cells are there. And so they're going to be apt to more expansion versus the areas that have been treated. But it can bring back the tissue some so that you don't have that expanded fat tissue. And it does get rid of the fibrosis in some areas so that the pain isn't as pronounced. And for many women later stage, it can bring them back some mobility, especially around the knee and ankle joints where it tends to accumulate.
Right. What other treatment? I think you mentioned earlier that you use some of the same treatment that we use for lymphangitis.
I use the pneumatic pump. You can use a vibration plate, which really does feel great to stand on and help with the tissue. Any type of movement. A lot of women see relief by being in the pool because that's the most compression that there is. But wearing daily compression that forces the lymphatics back up, the lymphatic fluid back up is really important. It's really hard this time of year when it's hot and sticky, but it actually does alleviate the pain and swelling in the legs, which is very helpful. A lot of women are experiencing relief with doing red light therapy. There's all kinds of different modalities being tested, but I think those are the main ones.
So you mentioned vibration. That reminds me of the TV infomercials where people would get on this thing and shake. So there's actually something to that.
There is some evidence-based research about the vibration plate. I know I was skeptical myself. I do it 10 minutes every morning and I notice such relief with it. The belief is that it can help to loosen fibrotic tissue. Yeah, and it feels really good. It moves the lymphatics and women will stand on it. And they range in prices from, $100 on Amazon to $1,000. And you can use it at any stage. So you can sit and put your feet on it, or as you advance in using it, you can stand on it. Some women will use it to do other exercises like squats and things of that nature. It can be just one more tool in the toolbox, so to speak.
And I would imagine that walking is an excellent tool in the toolbox.
That's one of the best.
Yeah.
Walking and even just being in a pool, walking in a pool, then you're getting a 2-for-1 there with the compression and the resistance training. Building muscle is extremely important in lipedema too, so that you can maintain obviously that basal metabolic rate, but just also helping to keep the muscle strength there.
And also you're squeezing the lymphs when you're doing like
Exactly.
Yeah. I would imagine that you talk a lot about this in Crave Nutrition, your private work. So how can people find out more about you?
Yep. They can find me on my webpage, cravenourishment.com, or on social media at Crave Nourishment as well.
Okay. And what is next for you?
I just applied for a grant actually to do some lipedema research with DNA testing, looking at if you do dietary measures that are guided by someone's DNA, will it lower CRP levels, the C-reactive protein levels, which we know the higher the C-reactive protein level, which is an inflammatory biomarker, that typically ladies present with more signs and symptoms of lipedema. My hypothesis is that if we use guided nutrition using DNA and testing, then we can lower that CRP and lower signs and symptoms. So stay tuned for that. I'm hoping to find out about that soon.
That's great. Thank you. So our last signature question is, if you could tell a younger version of yourself something about lipedema, what would it be?
I would tell them that an answer is coming, but all the things we just covered, I was thinking about if I could go back and turn back time, I would stop dieting and start making changes that I could live with sustainably. I realize now that going on and off of the diets, not only did it wreck my metabolism in many ways, but it wrecked my mental health too. So I would just start with the simple things. I would watch protein, I would watch fiber, I would drink more water, and I would give my gut rest. I find it interesting that our body works on a rhythm. Everything in the body works on a rhythm. And part of that rhythm is getting adequate sleep so that your body can rest, but your gut needs to rest and digest as well. And I think sometimes that's so often overlooked as just a basic principle of health. I wish I could go back and tell myself that if it sounds too good to be true and it's a quick fix, it is too good to be true and it's a quick fix.
All right. Thank you so much for spending the hour with us today.
Thank you so much.
Thanks for joining us this week on Food Junkies Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life Support Group. I'm Sweet Enough. Molly and Clarissa are food addiction professionals who offer one-to-one counseling and group coaching through Sweet Sobriety. Please subscribe to our show so you never miss an episode. While you're at it, if you found value in today's episode, we'd appreciate you leaving us a review on your favorite platform. Your feedback helps grow our show and allows us to reach others who need to hear this message of recovery. Don't forget to pick up a copy of Dr. Tarman's book, Food Junkies. And as Vera always says, the power is ours.